Hey everyone, today's conversation is about medication safety. If you are in medical affairs, if you are a pharmacist, if you are curious and trying to figure out how to make patients safe, how to have the medication that they take be safe, this is the conversation for you. Our guest today is the Associate Professor and Vice Chair of Pharmacy Practice at Butler University College of Pharmacy and Health Sciences, and he creates and disseminates healthcare and academic strategy to improve medication safety and patient health. Our guest today is John Hertig. Hey, John, how are you?
Hi, nice to be here.
Thank you for coming on. I do want to clarify a couple of things just so everyone's aware. I'm an attorney. You're a pharmacist. I'm also a pharmacist, but nothing we do constitutes either legal or clinical advice. We're giving general conversational advice that, technically we're not giving advice. We're just sort of having a conversation. They don't necessarily reflect our opinions or the opinions of our employers or clients. And we would love to have people come in, leave a comment, share, subscribe. So if people or guests have questions, we'd love to hear those questions as well. You can always find me on Twitter at Darshan Talks, or go to my website, DarshanTalks.com, or you can find John on LinkedIn at John Hertig. So, John, thank you again for coming on.
Yeah, thanks, Darshan.
So John, let's start from the very, very basic question. How much do you like penguins, and why are there three of them behind you?
Well, obviously, I like them a little bit, but yeah, no, I've always really liked penguins since being a little kid. And once people started to realize I had this affinity for penguins, they just started multiplying. So people just kept bringing me penguins, and now they kind of dominate my office here.
Have you heard that Benedict Cumberbatch actually cannot say the word penguin?
I did not. The incredibly talented guy. I didn't realize he had any limitations.
So always fun to find that out. I'll make sure I send you this thing because there was a show where he had to keep saying the word penguin because he was reciting it. Turns out he couldn't. It was hilarious. Anyways, speaking about things you can't do and talented people can't do, one of the things we struggle with in the world of medications is medication safety, and specifically, we're thinking of medication safety in the context of online pharmacies. Talk to me a little bit about why this is problematic. I mean, I'm speaking as a consumer, I'm speaking as a patient, and I'm going, the greatest thing in the world is I can be quiet. I don't have to tell people that I have named the problem. The medication will just come to my house and I don't have to worry about it. Why is this a medication safety problem?
Yeah, thanks, Darshan. I mean, there's no question the internet, which is pervasive, provides a lot of opportunity for access. And that's really important because, especially in the context of the pandemic, when people were locked in, couldn't get out, had health concerns, having the internet and the availability of medicines online or solid advice online is really important. The issue comes in the fact that there are lots of opportunities and a lot of illegal actors online that are selling really bad medicine. And that's where the patient safety concerns come in, Darshan.
So what I hear you saying is that the issue is not so much the method, it's the fact that there are bad actors in there. So first of all, let's start from the beginning. We've had online pharmacies since 2002. You and I were having earlier than 2002. That's when I graduated. This was earlier than that. So the dawn of the internet, really. I remember working on a paper with Andrew Peterson, and we were talking about online pharmacies and how you validate these online pharmacies. At that time, we were talking about VIPs and we were talking about all these other methodology to ensure that these are legit pharmacies. Why is that not good enough?
Well, you're right. I mean, as long as we've had the internet, we've had people selling stuff via the internet, whether it's toilet paper or Oreos. In this case, it's blood pressure medicine or opioids or even specialty products like oncologic agents. So, this is not a new issue, but it has exploded in popularity for a variety of reasons. One is the internet continues to get really popular. It's not going away anytime soon. We have big actors in there like Amazon and others that have made e-commerce, proliferative everywhere in the world. And we've had the pandemic. And again, we've made it really easy for people to access things online, rightfully so. The issue is the pure volume of bad actors. So at any one time, estimates are difficult, but there are between 35,000 and 40,000 online pharmacies. That's a lot of online pharmacies. about 95% of those, Darshan, are illegal in some way. So that's a huge portion of those that are doing something wrong. And that something wrong can be anywhere from not requiring a prescription. It can be not being licensed appropriately. Maybe they're not selling FDA approved medicines, or according to the WHO, about half of those are selling what we would call substandard or falsified medicines, but really they're counterfeit in some way. So they're illegitimate. They're not the real thing. They contain products that shouldn't be there, like arsenic or antifreeze or something like fentanyl, which we're seeing in the news, really taking its toll on those that are unknowingly taking fentanyl and just never waking up. And so this continues to be a major public health issue. And unfortunately, not a whole lot of patients know about it, and not a whole lot of professionals like us know about the extent of this issue online.
So what I hear you saying is that the problem, again, is the fact that the vast majority of these pharmacies are illegal, as you put it. And it's not just some require prescriptions, some don't. Some are actually selling bad product. So let's take a step back. If you control the world, how would you improve this process?
Well, if I controlled the world, Darshan, there'd be a lot of things that might be a little different. But, with regards to this process, those of us who do work in this space and try to really limit the patient safety impact, there's two major buckets. One is either control the supply, the other is control the demand. And when I say control the supply, that's the law enforcement piece. That's the people like Interpol, the FBI, a lot of the industry partners we work with. They have anti-counterfeiting groups that look into this issue to try to shut down those illegal websites and make sure that the sources of medicine are good. Because at the end of the day, we want patients to get the right medicine and do that in a way that's accessible anywhere in the world. So that's the supply. I don't do as much in law enforcement. I'm a lowly pharmacist, so I let the experts take that on. But I have learned a lot. I will say that I never learned in pharmacy school. But then for me, it's the demand side. And demand is, why are patients going online in the first place, right? And I think those of us that did work in this early on, and you mentioned 2002, even a little later than that, our initial thing was, well, just don't go online. If patients ask you, just say, why would you need to use the internet? And I think if you told anyone that now, you get an eye roll, and maybe worse. You got to use the internet. That's how we access a lot of information. That's how we access service. That's how we access product. And that's not going away. So it shifted from don't use the internet to how do we use the internet safely, right? And I think we've heard a lot about that in the lay press around how do you prevent misinformation? Well, it's how do you prevent misdrug as well? How do you prevent getting someone shipped or getting a drug shipped to your door that's not gone through the proper review? That could be anything that's been made in a back alley somewhere else in the world, but you could still get shipped to your door in 2 days, right? How do you avoid that? And there are some tools available to the general public as well as to health professionals to guard against that risk.
So let's start with, so you said you focus on the demand part of this. So let's focus on that part. You're saying that we need to address this issue of misinformation and getting them the right information. So how do you do that? How do you make sure that the information they get is accurate?
Yeah. Well, one of the golden rules is always talk to your pharmacist, right? Always talk to your doctor. Make sure you have a good working relationship with your health professionals because they're there to help you. I think that's really important. The other thing is I say we, like this huge community, but the small group of us who have been doing work in this space, what we initially did is we went around to hospitals, health systems, colleges, schools, and we just basically, it was like the scare tour. We just scared people and look at how big and problematic this issue is. But at that time, we didn't have a whole lot of, well, here's how scary it is, but what do you actually do about it? Fortunately, now we have a little bit more of here's what you do about it. And we have trusted pharmacy sites that can be found online. We have resources from the National Association of Boards of Pharmacy, otherwise known as NABP, or Legit Script. Those are two great companies that help verify internet pharmacies, where you could just type the domain of the pharmacy into one of these search boxes and it'll tell you whether it's good to go or whether you should avoid it. We have a top level domain program. I had no idea what a top level domain was until I got involved in this work, but that's like the .com or .gov or .edu. Well, there's a .pharmacy top level domain that's uniquely controlled by NABP. You can't counterfeit it. You can counterfeit VIP seals, Darshan. You can cut and paste certificates, but you can't counterfeit a top level domain. So there is work being done in this space around trying to help consumers make really good choices.
Which sounds like a good idea, but on the flip side, doesn't that suddenly make NABP the decider of what makes a good pharmacy? And is that necessarily the power we want NABP having?
Well, fortunately, NABP isn't the only player in the game. And so there is some diversification of other groups that are involved in this. And, the other nice thing is it's not them subjectively deciding. I mean, what they're doing is following the law. And the law is there. Are they licensed in the jurisdiction? Are they selling US FDA approved product? I mean, it's the basic stuff that consumers would want to see. And they're just running through that checklist.
But what if I say tomorrow decide to open up a pharmacy and I don't register and have a .pharmacy domain? Even though I may be a completely legit pharmacy, that puts me at an inherent disadvantage because I would show up as a potentially fraudulent pharmacy.
There's an important distinction there because you're bringing up a really good point, Darshan. You don't have to get a .pharmacy top-level domain, and actually there aren't a ton of people that have got it yet. It's still pretty new, but you can still end up on the recommended list. And so that recommended list that's kept by a number of these organizations is separate and distinct from the .pharmacy top-level domain. And Darshan, I knew you'd do the right thing, and I know you'd be legitimate, and so you'd end up on that recommended list for sure.
So if I want to land up on that recommended list, all it is telling them I'm out here too and just put me on, or is there a payment program that goes along with it?
Well, there's no payment program for just being a good actor. So if you want to be verified, they'll come find you and verify you. If you did want to do that top level domain program we talked about, the .pharmacy, I believe there is a cost associated with that. I don't get any of those kickbacks, so I'm not going to recommend it necessarily, but it is available, but I think a cost comes with it.
Fair enough. But now let's compare that or contrast that with, instead of Darshan's pharmacy creating a pharmacy, right? And I'd be great at it. I'd love sitting in the pharmacy. I've done that.
I know you would. You do. I hire me, hopefully.
But let's contrast that with the actual players in the game right now. You've got your Amazons of the world. You've got your Rose of the world. Who are all selling specific supplies. Some are in erectile dysfunction. Some are in transfer of medication and medication reconciliation, or et cetera, et cetera, et cetera. The only reason I say that is because Amazon bought something that is in MedRec. But I guess my question for you is, are they now going and registering with 50 states and saying, each of these states, we should be part of your program? Or is there a better... They are.
Yeah, they are. And it's interesting. Amazon Pharmacy is doing a lot of really great things. And I believe, in buying PillPack or integrating PillPack, I think they've clearly set themselves apart. And they represent a major access point for people who need medicine. They did have to go and register in every state. And actually, when they first launched back in November, I believe it was November of 2020, they weren't registered in every single state. And so you'd have to drop down and actually select what state you're in. And they're like, oh, sorry, we're not licensed there yet, because that is the law. Like, you have to get a pharmacy license in the jurisdiction you operate in. And Amazon's been playing by those rules. So we want them to be held up to a certain standard, and we want to promote people like Amazon or other actors that are doing a great job representing an access point for our patients. What we don't want is people just to go to canadadrugs.com and say, oh, it's from Canada, it must be fine. Spoiler alert, it's really not.
So don't go to canadadrugs.com. Hopefully that's not a real site.
Well, and the feds shut them down, so you can't even go there right now.
But. Okay, so it was a real site that actually got shut down. It was a real site,
yeah, and the owners got indicted. So.
Oh, okay. So yeah, don't go to canadadrugs.com. You aren't going to get very far. But we are now talking about medication safety. We're talking about this idea of having good pharmacy-based websites to get your medications. So let's explore that a little bit. And what I'm thinking about is the fact that you have certain disease states where there is a need for privacy. There is a need for making sure that my information doesn't get out. Let's pick erectile dysfunction, because that seems to be an area that gets focused on. The other one that I can think of is the baldness one. It seems like it's mostly men, but between the baldness and the erectile dysfunction, you've got you got pharmacies that focus on just that. And my question for you is, do you think that it raises concerns when these pharmacies only sort of provide for one drug or a class of drugs? That raises to me some risks associated with that. And what I'm thinking of is this idea that when I go to my pharmacist, I say, fill this prescription for me. I don't give him or her a list of all the other medications I'm on. The idea is that eventually they'll get that full list and they can do an appropriate sort of medication safety review. But that would never happen in the case of a pharmacy site that only looks at one or two drugs. Are there actual concerns that come up with that? How is that addressed?
Yeah, thanks, Darshan. I think you're bringing up a really valid concern. And let me take one step back. And the reason that people generally go online to buy prescription medicines, particularly, are threefold. So cost, convenience, and access, right? So it's because they want a better deal. That's what everyone goes to first. I mean, it's not the only reason, but that's what everyone goes to first. But convenience and access are two growing reasons that people go online. Access, there are lots of places in this country that are designated rural that really have pharmacy deserts, healthcare deserts, people that struggle with access. That's a problem. And the internet is a great avenue to help solve that problem. So that's a really important consideration that we shouldn't leave behind. The other is the convenience and access for those who do want to stay anonymous. And you mentioned sexual health. That's one of the big reasons. I was involved in a really wonderful project in New York City around HIV/AIDS medicine, where it wasn't cost, because a lot of that can be freely accessed from a cost standpoint. It was around not wanting to go into a sexual health clinic. The stigma, which is incredibly strong with that community. It's that represents a major access threat. So you're absolutely right. There are other reasons that people go online, and some of the pharmacies or technology companies, because some of them don't even call themselves pharmacies, even though they technically are licensed as such. They cater to one individual, either disease state or drug type. They're fulfilling a need, right? They're running a business. They're fulfilling a need. If patients are getting access to meds they need, that's not a bad thing. So that's really, really good. So I can't criticize that. I think where we have some room for improvement is if you're using pharmacy A for this, pharmacy B for this, pharmacy C for this, pharmacy D for this, online pharmacy F for this, but none of them are talking to each other. Now you're starting to get into a little bit of a medication safety concern, because you're not able to have one cohesive list of all medicines a patient's taking. And you know this, Darshan. I mean, that's when you start running into duplication troubles, drug interactions, other considerations that are really important. So I do think we have a little bit of ways to go in terms of making sure that patients' complete health is available and easily accessible.
So there have been some movements around creating interoperability. I believe the Cures Act actually comes out and talks about interoperability of systems. Do you believe that system will help, or are we still in a world where the interoperability really speaks to EMRs, and these aren't EMRs in the traditional sense? So they're not the systems don't speak to each other.
I think we have made some major strides. So yes, the CARES Act, Health Information Exchange, interoperability, those are all improvements that are being made. And some of the major connections are often insurers, because insurers and claims data, they have a lot of that information, even if you get it from different places. So we often rely on our insurers in addition to EHRs and HIEs, health information exchanges. But if you're paying cash, or if you're using a different payment method, that might not always flag on those types of databases. So that's where, to your point, we have a little bit of ways to go with regards to interoperability.
So we've now landed up in a scenario where we have some ways of controlling the type of information that gets out. So we're talking about having legit pharmacies, if you will. We are talking about some potential possibilities for improvement. So we've talked a little bit about these different programs that are out there on validating it and sort of going through that process. But let's talk a little bit about the product itself. And you talked about something could be made in a back alley and then sent out. And what you're really referring to is the black market and the gray market of drugs. My question for you is, there have been multiple efforts by the FDA to track that. There are, I know several friends, I'm sure you do too, who are interested in drug tracing and drug tracking. What do you think about the efforts so far? Are they mostly pie in the sky? Are they mostly good ideas but bad execution? Or are we there already?
Yeah, I got to tell you, I think the FDA is doing a really good job. It's an incredibly complex problem, but there are lots of departments and divisions at the FDA that are involved in this. There are U.S. mail facilities involved in this. There's FBI involved in this. The U.S. Patents and Trade Office is involved in this. It's very complex. Just to give you a really brief snapshot of how this might work for the average consumer, if you're not aware, is you could so you get on your computer, okay, and you know that Canada, there are friends, neighbors to the north, maple leaves, moose, it's all good. And my wife is Canadian, so I feel like I know this pretty well. And so we get on there as a U.S. consumer and we Google it and we say, okay, I'm going to get my blood pressure medicine from buy your Canada drugs here because we trust it. And they claim to be Canadian, but they're not actually Canadian. In fact, their servers are hosted in Brazil or China, right? And then they take your order, they take your personal information, and they process your payment via credit card, but they use a bank in, say, Azerbaijan, because they can't use Visa, they can't use MasterCard because they would flag that as an illegal transaction. And so they use this third-party bank in Azerbaijan. And I'm using real countries because this is what the data supports. I'm not trying to flag any one jurisdiction, but this is what we've seen. Processes your payment. They then send that, and it gets filled in, say, Mauritius or part of India. It gets filled in whatever manner. Maybe it's real product. Maybe it's diverted product that's real. So it fell off a truck. Maybe it is just dextrose, or maybe it's really dangerous, right? And it's all three of those. They then ship that to a person in Canada. So maybe a home, maybe a back alley business, who then repackages that product, slaps a maple leaf on it, and then drops it in the post into the US. And so you as a US consumer have no idea how those criminals took advantage of a global supply chain. I mean, that's a really, if you're trying to fight that, if you're the FDA, if you're some of these other policing agencies, that's tough to track down. And that's why I'm so involved in the demand side, where if I can prevent that order from ever occurring in the first place, then we're not contributing to that patient safety risk.
So what I'm hearing you say, well, two different things pop out for me from that conversation, right? So the first thing that pops out for me is this idea that, what do you think about people who just cross the border? People who live in the Canadian border, they have their things like a weekly trip that goes up through Canada. You go into Toronto, you go into Montreal. I forget if they're border cities. They probably aren't now that I think about it.
Maybe Windsor across from Detroit.
Thank you. Much easier to go that way. Thank you. I appreciate that. Windsor. So you go to Windsor and you pick up your medications and you come back. Is that safer?
It is safer. I mean, it really is. And some of that's what's called personal importation. They have a little bit of definition. And I've even heard, and I haven't seen this, but I've heard of even organized, bus trips for seniors and others that go across the border. For that, I'm not concerned about, because they're going to see a legitimate health practitioner to get a prescription. They're typically going to a legitimate pharmacy, brick and mortar pharmacy, to pick up their prescriptions. And so they're getting Health Canada approved drug. They're talking to a health professional. They're getting their questions answered. I mean, that's fine to me. That's not what I'm worried about. I'm worried about the anonymous website where you don't have any prescription, you don't get any counseling, and you get a product that could be from wherever, containing whatever.
So what do you think about using something like blockchain to start tracking this? They've been talking about that for a while.
They have. Yeah, I'm excited about the blockchain opportunities, because I do think blockchain has a role here. It clearly has a role in supply chain security and integrity, right? And so if we can expand that use to this issue, which I think we can, we just need to better understand it, that would certainly represent a huge leap forward for us. The other thing is there's legislation around this issue as well, federally, where there are pieces of legislation that want to shine light on domains. Where are you actually located, right? Just like if we knew where a brick and mortar shop was, we should know where we're shopping online too. If you say you're in Canada, then I would like to see that you're actually in Canada, right? So sunshine is the greatest disinfectant. It'd be nice to be a little bit more transparent around where our domains actually are.
Do you think this is going to sound like a really weird answer, but if I go to CanadianDrugShop.com, and I really hope that's not a real website, but if I go to CanadianDrugShop.com and it has an address on there, maybe the requirement should be you need to put an address on there. Should I then just be using Google Earth or Google Maps and zoom in on that location, see if it's an actual pharmacy that decides whether I shop from there? Is that a good idea or is that a terrible idea because you still don't know?
Well, it's not a bad idea, Darshan, but they could be using another pharmacy's address, right? So even if you zoomed in, problem with this is now I've learned to be a criminal. That's like the worst part of the whole thing is now you start thinking a little differently. But if you had zoomed in, I could use another pharmacy's address so that when you use Google Earth, you would still see a pharmacy and have no idea and be none the wiser.
Right. So the question then becomes, you now have copyright issues to deal with, but you're right. It creates this entire issue that the pharmacy doesn't want to deal with because they may be fraudulently being misrepresented. But it sounds like it's just an incredibly complex problem that's not easy to solve. What are the easy low-hanging fruit to solve this problem? Like what is going to be that 80-20 solution where the quickest things will get you that 80% result, and then there's the 20% you have to deal with for the next 15 years?
Yeah. Well, I like that you said really complex because I think you just described medication safety. Like any medication safety problem, I think is in general pretty complex, which you've heard on your show. And this is certainly complex. In terms of low-hanging fruit, one, we need to do a much better job educating our physicians, our nurses, our pharmacists, our allied healthcare professionals on this issue, because we've done research, Darshan, and it's a little scary how little pharmacists know. And pharmacists are the medication use experts. And we found pharmacists get this right or understand this about half the time, right? So it's a coin flip. We clearly have more work to do to educate our health professionals, because if we're going to tell our patients, hey, go see your health professional first, and we don't know, well, that's a problem. So right. That's low-hanging fruit. And then the other is, let's try to educate our patients a little bit more about safe sources of medicine. If you're going to go online, there's nothing wrong with going online if that's what you want to do. It's about how to go online safely. And there are tools. I've mentioned a couple of them, the NABP tool, Legit Script. There are others. Verify before you buy. It's as simple as paste the link into the box and click search. And if it says good to go, then you're good to go. And obviously, cvs.pharmacy.com, walgreens.pharmacy.com, kroger.pharmacy.com, many others. I'm not here promoting any one particular pharmacy. But those that have reputable brick and mortar locations that have an online presence, those are clearly fine as well.
Awesome. Any parting words?
No, I really appreciate the time to talk today, Darshan. I'm clearly passionate about this issue. And if people do want to get a hold of me, please get in touch with me on LinkedIn, and I'd love to start a conversation with you. Thank you again.
I was supposed to actually post his LinkedIn address, but this conversation just got away from me because it was so fascinating. John, thank you again. Just so everyone knows, you can find John on LinkedIn as John Hertig. And you can find, and oh, by the way, I do also want to comment on a couple of things. He is going to be speaking. So if you're interested in meeting John, but you really like cold temperatures, you should go to the annual AMCP meeting. On the other hand, John is willing to meet you during warm temperatures as well. So if you go to the ASHP summer meeting, he will be there in Arizona as well. Anything else, John?
That's it, Darshan. Thank you very much.
Thank you again. Take care.